Joining us now is Paul Rieckhoff, the founder of Iraq and Afghanistan Veterans of America. He's now the host of Angry Americans, a podcast. Paul, thanks very much for joining us this evening. It's good to see you, my friend. I'm really glad you're able to be here.
Good to see you, my friend. Thank you for all your leadership.
Well, talk to me about how you feel about this VA story. I feel like I do not want to be reductive, and I do not want to think about every VA medical center as being the same as every other. I know that state-run veterans' homes are having different challenges than VA medical facilities, but it strikes me as nuts and increasingly actually just weird that the VA is maintaining this public front that everything's fine, they don't have any shortages, they've got no problems.
Well, it's dangerous and potentially devastating. Here's the big picture. We now know we're a nation at war against the virus. We're a globe against the virus. But here at home, there are two major forces that could add tremendous resources and either be the cavalry or be a deck of cards. The Department of Defense on one side and the Department of Veterans Affairs on the other side. The Department of Veterans Affairs serves 9 million people nationally. You've talked about the resources they bring to bear, and they have a sacred duty to care for our veterans, and that's important. But this time, it's much bigger than that. They are the nation's backstop. So every time I've come on your show for over 10 years, we've talked about VA problems, we've talked about data issues, and it's always affected mostly veterans. Now, it affects you. It affects everyone. Because if your hospital overflows, the VA is tasked nationally to be there to control that overflow. So they haven't been clear, they've been slow, they haven't been transparent, and the bottom line is the VA is not ready. The Department of Defense, I would argue, is not ready either. But the VA is not ready, and the Secretary of Veterans Affairs, you touched on it, he wasn't seen in public for over a week. He wasn't just not doing briefings. I mean, he apparently takes Easter off. He's not putting anything out on Twitter. He's totally AWOL. That's why I've used the hashtag #WhereIsWilkie. He should be the lead element on combating the virus and providing support not just for veterans, but for the entire public. And he's been MIA, and that's a failure of leadership that should concern everybody.
Paul, one of the things that you have raised both online and on Angry Americans is concerns about testing. As far as we can tell, the VA has only conducted about 37,000 coronavirus tests. And I know that just sounds like a random big number, but for perspective, New York State has conducted more than 12 times that amount. The VA is putting out daily numbers. They do have a lot of facilities. We know about a lot of VA staff and a lot of veterans themselves in the VA system who are positive, but it seems to me like the testing number should be a lot higher, particularly since they are a health system directly run by the federal government.
100%. I mean, think about it. They serve 9 million people. They're supposed to be the nation's backstop, and they've always only tested about 35,000 people. I mean, there was a point where New York State was testing more daily than the entire Veterans Affairs Department had tested so far. And what we found at the Veterans Affairs Department is the more they test, the more they find. And you've touched on this on your show. You can see where outbreaks are coming. You can see where problems are emerging. New Orleans has a number of cases that's about 3 times the number of most other places. And then you see places like New Jersey and New York where the deaths are concentrated. You're starting to see Detroit and Washington, D.C. And then you see where things are working, like California. So this is a real insight into how the coronavirus could hit other cities, could hit rural areas. But also, you've got to underscore the fact that this is an extremely vulnerable population. More than half of patients that the VA serve are over 65. They've got tons of these retirement communities and retirement homes, and the state ones are, again, maybe just a canary in the coal mine. Maybe we push tons of resources and it's not a problem down the line, or maybe this is the tip of the iceberg. So everything that happens having to do with the coronavirus in the United States should center around and with the VA. They can be our cavalry, or they can be a house of cards that falls beneath us when we need them the most.
Paul Rieckhoff, the founder of Iraq and Afghanistan Veterans of America, the host of the Angry Americans podcast. Paul, thank you so much for your time on this. Thank you for sticking with this. Come back and talk to us about this as this story develops. I think the first thing that has to break here is that the VA needs to be honest about what's going on. But when you're talking about substantively what needs to be done, I want to continue tracking that with you, my friend. Thanks for being here.
100%. My pleasure. I hope that the Secretary will join you before I join you again.
I'll do my best. All right. Thanks, Paul. All right, we've got much more to get to tonight. The top Democrat in the Senate, Chuck Schumer, is going to be joining us live in just a few minutes. Do stay with us.